Foot necrosis is a severe condition characterized by the death of bone, skin, or other soft tissues in the foot due to insufficient or complete loss of blood supply. As a result, living cells cannot receive oxygen and nutrients. Their vital functions are disrupted and they die. In medical terms, necrosis means the pathological death of cells and tissues. Foot necrosis can develop for various reasons, but the general mechanism is the same: interruption or severe reduction of blood flow. In medicine, foot necrosis is classified into several main types. One is avascular necrosis, osteonecrosis, in which bone tissue dies due to disruption of the blood circulation within the bone. Another common type is gangrene, which affects not only the bone but also the skin and other soft tissues, causing them to decay and die. A third, particularly dangerous form is diabetic foot necrosis, which mainly occurs in people with diabetes. All three types, if left untreated, can lead to partial or complete amputation of the foot. The mechanism of avascular necrosis is as follows. Under normal conditions, bones are nourished by numerous small blood vessels. If these vessels are damaged or become blocked, part of the bone begins to die from lack of blood and oxygen. This process often occurs in the talus, metatarsal heads, or navicular bone of the foot. Causes vary: fractures or dislocations, blood clots, fat embolism, long-term use of steroid medications, excessive alcohol consumption, certain blood disorders, such as sickle cell anemia, autoimmune diseases, and lipid metabolism disorders. At first, the process may go unnoticed, but over time, pain, swelling, and restricted movement develop. Gangrene more often affects soft tissues. In this condition, tissues die and decay due to lack of blood flow and/or infection. Gangrene is divided into two main types: dry and wet gangrene. Dry gangrene usually occurs due to poor blood supply without infection. The tissue gradually turns black and dries out. Wet gangrene develops in the presence of infection and is extremely dangerous because bacteria multiply rapidly, releasing toxins that can spread throughout the body and cause sepsis. Diabetic foot necrosis is one of the most dangerous complications of diabetes. Diabetes damages blood vessels and the nervous system. Due to peripheral neuropathy, patients may not feel pain or notice injuries to their feet. As a result, even small wounds may go untreated, become infected, and gradually develop into necrosis. Because diabetes also impairs circulation, wounds heal very slowly. Infection may then spread deeper into the bone, osteomyelitis, or the entire foot. Early signs of foot necrosis are often overlooked. Initially, a person may feel pain in the foot only when walking long distances or carrying heavy loads. Later, the pain may occur even at rest. Swelling, pale or bluish skin, coldness in the foot, and hardened areas under the skin may appear. In some cases, especially in diabetic patients, sensation is lost, and the patient feels no pain, meaning the condition is detected very late. When gangrene develops, black patches, a foul odor, and severe inflammation can be seen in the foot. Diagnosis begins with a clinical examination. The doctor listens to the patient's complaints, examines the foot, checks skin color, temperature, swelling, and pulse. Then imaging tests are performed. X-rays can show bone changes in the later stages of necrosis, but are less useful in early stages. Magnetic resonance imaging, MRI, detects even the smallest changes in bone and soft tissues, making it the best tool for early diagnosis. Computed tomography, CT, provides a detailed view of bone structure. Blood tests help detect infection, inflammation, diabetes, or other systemic conditions. Treatment methods depend on the type and stage of necrosis. In the early stages of a vascular necrosis, reducing the load on the foot, using crutches or orthopedic footwear, taking non-steroidal anti-inflammatory drugs to relieve pain, and medications to improve blood circulation can be effective. Physiotherapy and rehabilitation are also beneficial. In more advanced cases, surgery may be required. Core decompression, drilling into the bone to relieve pressure, bone grafting, or joint replacement, arthroplasty. In gangrene, the main goal is to stop the infection and remove dead tissue. This involves antibiotics, surgical debridement, and in some cases, amputation. If wet gangrene is present, treatment must be urgent because the infection spreads quickly. Hyperbaric oxygen therapy can also be used in some patients to improve blood supply and slow the necrosis process. In diabetic foot necrosis, the most important thing is to control diabetes. Blood sugar levels must be kept within normal limits, and wounds must be treated in hygienic conditions. If infection is detected, antibiotics are prescribed. If necessary, necrotic tissue is removed or amputation is performed. Prevention of foot necrosis is possible by maintaining a healthy lifestyle, quitting smoking, limiting alcohol, eating a balanced diet, regular physical activity, and controlling blood pressure and blood sugar levels are essential. Diabetic patients should check their feet daily and treat even minor injuries promptly. Protecting feet from cold and avoiding tight shoes is recommended. Any pain, swelling, skin color changes, or wounds should be reported to a doctor immediately. Foot necrosis is not a condition to be taken lightly. If detected early, treatment can be effective, and the foot can often be saved. In delayed cases, however, the process can lead to disability and a serious decline in quality of life. Therefore, prevention, early diagnosis, and timely treatment are the strongest weapons against foot necrosis.